This is Bonnie McGregor. Dr. McGregor is a clinical psychologist and behavioral scientist. She is the executive director and founder of the Orion Center for Integrated Medicine in Seattle. She specializes in helping people cope with cancer and chronic illness, depression, anxiety, and stress, utilizing mindfulness practices and cognitive and behavioral techniques. Bonnie, thank you.
Thanks for being here. It's the kickoff session of the EASE Winter Lecture Series. I'm so glad that you guys are all here. I think this is a brilliant idea and I'm super excited about it. I'm gonna now, I've got some slides that I'm gonna share while I'm talking. So if you can just make me if you go in the right corner of your Zoom, you can click speaker view, and then that'll just have like one big screen, and then everybody else will be kind of off to the right, smaller. So let me just share my screen with you now. I know when we first started doing research with these, doing our research intervention online, I used to have to explain to people what Zoom is, but not anymore. So you can see my screen, I think now, right? Everybody can see it? All right, let me get rid of this. So today I'm going to be talking about stress management for cancer survivors and everyone else during the holiday season. As you guys know, this is a really intense season. It's a season for holidays. It's a season of bad weather. I initially made this slide for people in Seattle, so I've got some person rocking through the rain and the dark here. It's also a season of light. We tend to hope that this can be a peaceful, joyful season, but a lot of years it looks more like this. This is your Eastern Washington picture. It can be tough. It can be really tough. And when you add the stress of the holidays, this is what holidays used to look like: shopping, crowds. Remember those days? Doesn't that just look weird now to see everybody without a mask that close? So in a way, it's nice that we can do online shopping now, I guess. And then when you add to all of the winter difficulties and stress, the COVID pandemic, which we've all been coping with for 9 or 10 months, got the COVID time warp. I mean, we're fatigued, right? Wearing a mask, social distancing. You can see this curve of the daily confirmed death. This is a rolling 7-day average through December 11th. So I've been telling everybody that we've been fighting this war for about 8 to 10 months, and now we know the end is in sight. There's a vaccine coming, but we got to get up this hill. I mean, it's literally a hill that we're climbing at the end, and we're tired. We're tired. And then when you add on to all of that, being a cancer survivor, it's a lot. It's really a lot. And one of the things we know is that social connections are really important for us as humans. We're wired to be social animals. We have mirror neurons in our brain, so that if somebody smiles, we automatically smile back at them. We are social creatures. So this disease, this COVID disease, is really, really hard on everyone because of the social distancing. It's especially hard on cancer survivors. We know that, or my colleague Susan Leckendorf has shown in ovarian cancer survivors that social isolation is associated with poor survival. You can see here low social attachment, which is these folks are socially isolated, versus high social attachment. And this is the survival curve. So you can see these folks in yellow with higher social attachment are doing better. These are ovarian cancer survivors, so they've got a higher mortality rate. We don't have data similar to this in other cancer survivors, so I'll just make that a caveat. But the take-home point from this is that this is really hard, in large part, because we're having to be so socially isolated. So how's everybody feeling right now? Just check in with your body. Are you feeling that tension in your chest? Maybe your breathing's a little more shallow. This beautiful snowflake is a cognitive reframe. Snow can be really beautiful also. And it's just a reminder for us to pause, get really present, and just take a deep breath. And as you exhale, can you feel that relaxation response? How's that tension that you were feeling in your chest change as you exhale? If you didn't notice it, try taking another deep breath, breathing in as deeply as you can, and then hold it. And then as you exhale, see if you can feel that relaxation response. Good. So I tell everybody that this is the best time in history to have a cancer diagnosis because more and more people are surviving cancer. People who would have died from cancer years ago are now living with cancer successfully. It's kept stable, or they are living with no evidence of disease because of the amazing new treatments. And we predict that by 2022, which is just 2 years from now, 67% of the estimated 18 million people diagnosed with cancer will survive beyond 5 years. And for some diagnoses like breast cancer caught early, it's up in the 99%. This is really a good time to get a cancer diagnosis. And at the same time, survivorship comes with a price. I don't have to tell any cancer survivor this, but when you get through the diagnosis and treatment and your physician's like, yay, there's no more cancer, and your family's like, yay, let's get back to normal, and the survivor's thinking, whoa, wait a minute, why don't I feel better? Because survivorship comes with a price that takes a toll on us emotionally and physically. So there's changes in physical appearance and functioning, fatigue, which can last like 5 to 10 years even after the end of treatment, cognitive difficulties, which are related to chemotherapy and the inflammation that comes with that. A foreshortened future, fear of recurrence. I don't know any cancer survivors who do not have fear of recurrence, just that little thing like waiting for the other shoe to drop. If you get a pain, your thoughts go immediately to, oh, is that my cancer coming back? Increases in pain, changes in sexual functioning, altered financial status. Cancer is a really expensive disease to treat, and changes in social relationships. I've heard people say that people that they thought were their friends really maybe didn't step up for them. There's a few people that didn't, and they were surprised by that. And then other people that they weren't as close to really did step up. And you find that there's some people that you're still great friends with, but other people not so much. You have different needs. So there really are a lot of changes that come as we move into survivorship. I mentioned that there's emotional healing that needs to happen. So cancer diagnosis it can be really traumatic. We know that more than 30% report clinically significant distress. So this is distress that meets diagnostic criteria for a psychological diagnosis. General depression rates are 3 times higher than the general population in cancer survivors. 34% report clinically significant anxiety. So these are all like meeting clinical criteria. The rates of people reporting symptoms are even higher, even if they don't meet criteria for a diagnosis. We found too that those with early childhood trauma or multiple concurrent life events tend to be more vulnerable to emotional difficulties. I think of this as like having this feeling part of your body. If you've got a lot of different stressors that hit you in a row, like a divorce and then a job change and then a cancer diagnosis, all those things, they take emotional processing space. And if you get hit all at once, it gets kind of clogged up. And so that's when people come to see me. It's like, why don't I feel better? I feel kind of numb. I can't seem to work through this. It's because there's just too much that's happened in too short a period of time. So this is a survivorship stages and challenges. And I'd like to point out right here that this is treatment completion. So this is like everything that's happened before treatment is not even on this slide. So you can see there's this early reentry phase. This is stressful because people are thinking, wait a minute, I'm not going in to get my treatment every week. There's no safety net. You feel kind of like you're tossed out into the abyss. In fact, I had one breast cancer survivor say, I had 118 appointments, surgery, chemotherapy, and radiation, and I feel like I just got spit off the end of the treatment treadmill into the survivorship abyss. So during this time, you can see we see fear of recurrence coming in, depressive symptoms, fatigue, cognitive difficulties, pain, cancer-specific sequelae, like depending on your chemotherapy, you might have peripheral neuropathy. We also see finding benefit. What's that? So we know that right here, finding benefit. We were one of the first to show that working through an adverse event, which is what we call something like a cancer diagnosis and treatment, if you stay engaged with that and work through it, you actually become stronger emotionally and you can find benefit in the experiences. And you hear people describe this as like, I wouldn't wish this on anybody, but looking back on it, once you get far enough out, I don't know that I would change it. And then this is a time when many people return to work, and that's always challenging. And some people decide that they don't want to return to work full time. So then 2 years after diagnosis, you move into early survivorship. You can see there's still the same challenges and benefits. And even 5 years after diagnosis, like I said before, you can still, fear of recurrence is almost always there. Fatigue can continue, cognitive difficulties, pain, and that cancer-specific sequelae. As you're going to hear later with the EASE folks, using exercise. Exercise can actually help with fatigue and cognitive difficulties. So there are things that we can do, and that's kind of what we're going to be talking about in this lecture series. So we talked about distress after a cancer diagnosis, but it actually occurs across the cancer continuum. Before diagnosis, among those who are at increased risk due to family history, when you get the diagnosis and through treatment, immediately post-treatment, like I talked, when you first enter the survivorship abyss, and then on into survivorship. So I'm really interested in the effects of chronic stress on biological function. And this is like a laundry list of the effects of chronic stress. So we know that chronic stress is associated with increased vulnerability to the common cold. They did a study in Great Britain where they actually brought folks into an apartment building. They inoculated with them with one of 5 cold viruses. You can never do that now. And then they put them in apartments to see who got colds and how bad they were. But before they did that, they gave them a paper and pencil measure to ask how stressed they were. And they found that there was a direct linear relationship between how stressed they were and how bad their cold was. There's a lot of work showing that chronic stress is associated with slower wound healing, general decrements in immune function. When I think about people getting the vaccine for COVID, I think about they're going to give it to the healthcare workers who are working in these really high stress environments. And we know that chronic stress can suppress your ability to make an antibody response to vaccines. So I hope that I'm sure the vaccine is so efficacious that they're going to get some benefit, but I wonder if anybody's really looking at that. Chronic stress is associated with high blood pressure and high cholesterol, and those things can lead to heart disease. Chronic stress is associated with weight gain, including central fat storage. This is the type of fat that's not good for you. Chronic stress is associated with poor control of blood sugar among diabetics. So people who have diabetes, they know that when they're stressed out, it's harder for them to maintain their blood sugar. When we're stressed, we tend to have poor health behaviors. We're not likely to eat very well. Our diet's poor. We're more likely to smoke if we do, and we're less likely to exercise. One thing that I think is really interesting is a few years ago, a friend of mine, Alyssa Eppel, showed that chronic stress associated with caregiving a chronically ill child was associated with shortened telomeres and telomerase activity. And you may be wondering, what's a telomere? So telomeres are these little things on the end of our chromosomes. They're kind of like those plastic things on the end of our shoelaces. You know, we have a shoelace when we used to tie our shoes. They had these little plastic things at the end that would keep the shoelace from unraveling. And that's what telomeres do for our genes. As cells divide, the telomeres get shorter and the genes become a little bit more unstable. That's why aging is associated with increased risk for cancer. And telomerase is something that keeps those telomeres in good shape. So Alyssa showed that chronic stress suppressed telomerase activity. That's just a protein in our body that keeps those little end caps on the genes in good shape. And then she saw shortened telomeres associated with the chronicity of caregiving. The longer they were a caregiver, the shortened their telomeres were. We know that chronic stress is associated with increased rates of DNA damage and poor repair. It's associated with increased rates of VEGF production. The VEGF is a vascular endothelial growth factor. This is some work that my colleague Susan Luckendorf did with ovarian cancer cells. She dumped the stress hormones epinephrine into tissue cultures that had ovarian cancer cell lines in them. And those cancer cells had receptors for those stress hormones. And when you added stress hormones to the cancer cells, they started kicking out tons of this VEGF stuff. What VEGF does is it's a normal occurring protein in our body, and it makes blood vessels. So you can imagine a cancer cell starts as one cell, then it's 2, then it's 4, then it's 8, and it just becomes this clump of cells. You need to have blood vessels to feed that clump of cells. And if stress causes increased production of that clump of cells, or VEGF production, so you get more vascularization of that clump of cells, it can be associated with increased bulk of the tumor. Her colleague, Anil Sood, went to MD Anderson. He was a postdoc in her lab. And at MD Anderson, he showed in a mouse model that chronic stress in mice was associated with increased VEGF production, increased vascularization of tumors, and increased tumor size. And they could block all of that with a beta blocker, which was blocking that receptor on the cell that bound those stress hormones. So they're doing studies now looking at beta blockers in ovarian cancer patients to see if that can block the effects of stress. They've also seen this in lung cancer. It's not working out as well as they'd hope because there's beta adrenergic receptors all over our bodies, and beta blockers also come with side effects. But what it's showing conclusively is that stress, via the stress hormones epinephrine and norepinephrine, were associated with increased vascularization of the tumors. We've also shown that increased rates, or chronic stress is associated with increased rates of tumor cell metastases, again in a mouse model of breast cancer. And also we're seeing now that it's associated with resistance to chemotherapy. If it's associated with DNA damage, and these cells are dividing really quickly, you can imagine that there's mutations that are happening that would be selected for being able to be resistant to the chemotherapy. Sometimes a picture says it better. So here's another way to think about the effects of chronic stress. This is some of us before work and after work. So people would always ask me at the Hutch, why am I a psychologist at a cancer center studying the effects of stress? And that's because all those effects of chronic stress, or these ones that are in pink here, those are actually biobehavioral cancer risk factors. So we know that immune function is important for cancer prevention. We know that weight gain is associated, especially central fat storage is associated with increased risk for cancer, and all these other things. Poor health behaviors, shortened telomeres, genetic instability is a hallmark of risk for cancer, DNA damage and poor repair. All of these things make a difference for cancer survivorship. And so that's why I was studying this as a biobehavioral scientist at Fred Hutch. So is anybody feeling stressed right now? It's a lot, right? It's like, holy crap. I do not want to be stressed. And it's stressful even thinking, holy, I've got to manage my stress better. So let's take a deep breath one more time, breathing in as deeply as you can. And then exhaling. Feel that relaxation response? That's your first stress management technique. So we've talked about how stress can impact biobehavioral outcomes that are important for cancer survivors. Is anybody doing anything about it? And the answer is yes. For a number of years, people have been studying psychological interventions for cancer survivors, and they've shown we can reduce distress, anxiety, and depressed mood. We can improve social support. We can enhance quality of life. We can enhance emotional growth, and we can improve immune function. I won't bore you with all the graphs and slides for that, but just trust me, there have been a number of studies that have shown all this. And there have been 2 studies that have shown that a short psychological intervention can improve survival in breast cancer survivors. And I will show you those data because they're so cool. So the 2 studies that I'm going to be talking about, one was done at the University of Ohio, or Ohio State University, sorry, Buckeyes. It was done by Barbara Anderson. It was called the Stress and Immunity Breast Cancer Project. It had stress management and coping, health behavior change, relaxation training, education to increase adherence to treatment, because chemotherapy treatment is hard and there are things that you can do to make it easier on yourself. They met weekly for 4 months, then monthly for 8 months. And this was a little bit higher intensity intervention than the other one I'm going to talk about, because these were stage 1 through 3 breast cancer patients. And you can see they had a little over 200 stage 1 to 3 breast cancer patients. The other study I'm going to talk about was done by Mike Antoni at the University of Miami, and that's the group that I worked with. It has also stress management and coping, social support training, relaxation training. There's a different relaxation exercise each week. They met weekly for 10 weeks. And this study was with about 240 stage 0 to 3B. So this was more early stage breast cancer survivors. This was not powered to look at survival. This one was. This is some data from the Mike Antoni University of Miami study. And these are not Persian carpets. This is just to show that their cognitive behavioral stress management intervention is associated with changes in gene expression. So if you look at these little green and red boxes here, you can see each little box here represents a gene. And there's about 200 of them in each column. Each column is a person who is in the comparison group or a person who was in the cognitive behavioral stress management group. So you can see there's about 6 or 8 people in this group and about 6 or 8 people in this. And if you look at it at baseline, you can't really see any difference between these 6 folks and these 6 folks, all their different genes. Some are turned up, some are upregulated, some are downregulated. And then you can see at month 6, so this is after the 10-week talk intervention with relaxation training, you can start to see that it looks like there's a little bit more red here. The red is that the genes are being turned on. The green is that the genes are being downregulated or turned off. So you can see here at 6 months, these are good genes. These are the genes that you want to be turned on. This is a panel of about 200 genes that are turned off and on in response to adversity. They're mostly immune function genes like interferon and immune activation and glucocorticoid sensitivity. Those are the good ones. Those are the you want turned on. The unhelpful ones are NF-kappa beta, CREB, PKA pathways, inflammation genes. So these are the ones that you want turned off. And you can see that you're starting to see changes in these genes, which genes are turned off and on in response to this intervention, even at 6 months, but at 12 months after the intervention, you can see the effects are even stronger. The people that participated in this 10-week talk therapy group intervention had the good more of the good genes turned on compared to the comparison group. Their good genes were being downregulated. And just the opposite was here. The unhelpful genes were being downregulated in the cognitive behavioral stress management group, and the unhelpful genes were being upregulated in the comparison group. So the take-home point from this is that this talking intervention, meeting with 6 to 8 other cancer survivors in a group, learning stress management and coping techniques, changed them. And it changed not only just how they were thinking and feeling, but it actually changed the genes, which genes were being turned off and on in their cells. We also, both of those groups showed that there was a reduced risk of death among the participants. So in the Ohio State study, these were patients that had stage 1 through 3 breast cancer. They had a 56% reduction in deaths. And the Miami study, this was not powered to look at death. We didn't expect to see a difference because these were relatively early stage breast cancer survivors. But you can see we had a 79% reduced risk of death. If these were chemotherapy agents, you know that these would be in the clinic right now. But unfortunately, these interventions are still sitting on the shelf. So does anybody want to learn a few stress management and coping techniques taken right from those interventions that I just showed you could change DNA, which genes are turned off and on? I think I can see everybody raising their hands. So first step is, let's just ask yourself, close your eyes, and if I gave you a stress thermometer where 0 is no stress at all and 10 is as stressed as you can be, what would that stress thermometer read right now? So just hold that number in your head. And now, again, take a deep breath. Let's take a few, actually. Breathing in as deeply as you can and hold it at the top of the inhale. And then exhale, and just imagine letting it go, just letting any stress go. Shake out your arms if you want a little bit. And then take another one. Take another deep breath, breathing in as deeply as you can. And then as you let it go, just imagine that you're sliding down a slide into a state of deeper relaxation, just really riding that relaxation response. And now, if I was going to give you that stress thermometer, what would that read? Did it go down at all? Did it go down even maybe half a number or 1 number? Even asking yourself, how stressed am I right now? What's my number is a stress management technique. And if it's above 5, then it's a good idea to do something, even taking a deep breath to see if you can lower your stress. We're going to do a little bit more intensive relaxation at the end of my talk. So we're going to do this again and see how low we can get it. So I've been talking a lot about stress, but what is stress? I mean, we all know when we're stressed, but does anybody know what it is? I'll tell you. Stress is the physical, mental, or emotional tension that we experience in reaction to an event. We experience stress when we perceive that our demands are exceeding our resources. So this is the holiday version of the slide. You can see the demands are exceeding the resources, right? Time and money is small, demands shopping, large. The key take-home point for this is, though, that is when we perceive that our demands are exceeding our resources. It's how we think about the situation. If I'm thinking about everything that I've got to get done between now and Christmas Day, I'm going to feel really overwhelmed because I can't do that all right now. I'm putting all the demands for the next 2 weeks in today. If I think about what I need to do right now, so it's clearly overwhelming my resources right now. But if I think about what I need to be doing right now, standing here talking with you in this time, it's balanced. I've got plenty of time to do what I need to do. My demands are matching my resources. Here's another way to describe it. Like I said, sometimes a picture does it better. So you can see her resources, her desk here is being greatly overwhelmed by her demands. This is not my office, but I think this is a really good way to just kind of convey the point. So is all stress bad? No, it turns out that when we have a little bit of stress, so on this graph here, you can see maybe that this is increasing distress along this line. And right along this line here, it says increasing performance. It could be performance of your immune function. It could be cognitive function. You can see that with increasing stress to a certain point, our performance actually gets better. And then we get into this comfort zone. This is like the zone, you know, when you're really kicking out work and you're just in the zone. So you can see it as the stress gets a little bit higher, we start to get fatigued. And then as the stress gets even higher, that our performance starts to fall, we become exhausted, our health becomes poor, and it can eventually lead to breakdown. So when we use our stress management techniques, then you see you can keep your performance going at even higher levels of stress, and it kind of plateaus instead of dipping so much. So I feel like I spend a lot of time right in here. Using these stress management techniques can help you cope with the stressors that you're experiencing right now. So we're probably right over here with this whole COVID thing and cancer survivorship. I mean, people are feeling the fatigue. Stress management techniques can help keep you performing at an optimal level, even though we're in this high level of stress. So how do we manage stress? Like I said, the key word is perceived demands and perceived resources. We want to balance those. This says, I don't know if you can read it, says, try these relaxation methods. If they don't work, I'll prescribe a tranquilizer dart. What's really funny about this is I had a colleague at the Hutch who was trying to make a decision about whether to move her family across country for work, and she was starting to get stomach pain. So she went to see her doctor, and her doctor was going to prescribe a tranquilizer dart or Prilosec. And he said, well, you have to take this the rest of your life. And my friend said, gee, doc, you know, I think it's stress. And the doc didn't know what to do about that. And to the doctor's credit, she felt really bad about that and contacted my friend a couple of days later and gave her the name of a hypnotherapist. The hypnotherapist taught my friend a couple of relaxation exercises, basically the guided relaxation techniques that we use in the cognitive behavioral stress management or SMART intervention, and she was fine. So this is my goal. I would love it if a doctor could just hand a patient a list of relaxation methods, but right now they just want to give them the tranquilizer dart. So step one, here we go into stress management. And a lot of these techniques are covered in our 10-week group that's built on the Miami intervention that I talked about earlier. We've got the next generation of that, and I'll talk about that in a little bit. But the first step is like increasing your awareness of stress. So how do you know when you're stressed? Does this woman look stressed? Yes. How do you know? Well, first of all, because her hair looks so weird. Second, because she's using this really dated computer. But more importantly, you can see that her time resources are really low. It's after 5 o'clock. And it looks like her work demands are really high. It looks like she's got some tension in her shoulders and her hands and her scalp. So how does she know when she's stressed? She's probably feeling it in her shoulders right now. So in the first week of group, we say, how do you know when you're stressed? We've got this whole long list of symptoms of stress. Here it is. All of these are symptoms of stress. So how do you know when you're stressed? I know when I get irritable with my kids that I'm starting to feel stressed. I know when I get tension in my neck and shoulders. You can see some people have sleeping difficulties. Some people get depressed. Some people drink or use drugs more. Irritability, like I said, our fears get worse when we're stressed. Anger, you can see it affects our gut, indigestion, constipation. It affects our concentration. We tend to withdraw socially when we're stressed. Not now, but we'd love to be out being more social, I think, now. But all of these things are symptoms of stress. So we ask people, what are the three biggest indicators of stress for you? And then you use those as your check engine light. You're checking in with yourself. So how's my neck tension right now? How's my irritability? Am I having trouble sleeping? The sooner you can intervene and start using some of your stress management techniques, the better off you're going to be. And so we can see the stressful situation affects us cognitively with concentration difficulties, emotionally makes us more irritable, behaviorally, we smoke and drink more, physically, we have muscle tension, heart rate can get up, and socially, we tend to withdraw more. It has a lot of, it affects us in a lot of different ways. The next thing we start talking about in our workshops is that it's not the situation itself, but it's our thoughts that determine how we feel about it. Remember that word perceived? This is explaining that here. So the world is a series of events, and it's not the world itself that's affecting how we feel, happy or sad. It's actually how we think about those events. The example that I always give for this is this place called Bellevue Square in Bellevue, obviously. It's a really fancy mall. I'm tall. You probably can't tell that from this Zoom talk, but I'm tall. I've never been able to find clothes. I hate shopping. So when I think Bellevue Square, this is how I feel. I don't want to go there. But when my friend thinks Bellevue Square, my friend Lisa, she loves to shop. She could be a professional shopper. In fact, she goes shopping with me to help me when I have to go because she's so good at it. When she thinks, there's Bellevue Square, she's thinking, I love shopping. I'm really good at it. And so she's going to feel happy. So it's not Bellevue Square itself. It's like what's going on in your head when you think about it that's going to determine how you feel. So what's going on in our head is our history, my whole history of like hating to shop because I could never find anything that fit. Everything that we learned when we were kids, all of our adversity that we felt or experienced when we were growing up, all of those things go into determining how we're perceiving our current environment. Also, when we think about the demands versus resources scale, if I'm thinking I've got to do all this stuff in the next 2 weeks and I've only got today to do it, if I'm putting all those demands right now, then I'm going to feel more stressed. So it's all how you use your thoughts. So to demonstrate how powerful thoughts are, I want you to just humor me and close your eyes and imagine a lemon. This is a perfectly ripe lemon. You could imagine it on a nice white cutting board. You can even smell the lemony essence. It's so ripe. Now you'll notice there's a knife on the cutting board next to the lemon. Pick up the knife and just carefully cut the lemon in half. And as you cut it, the juice kind of drips over your fingers. You can kind of smell that little lemony essence coming up from the skin. Now I want you to imagine picking up the lemon, bringing it up to your nose, smelling it. It smells good, doesn't it? Now I want you to imagine just taking a bite out of the lemon. Can you feel that pungent taste in your mouth? Feel the shiver going down your spine? I want to ask, usually when I'm in audience, I ask how many of you salivated in response to taking a bite of the lemon. I usually see a few people puckering up, but most people at least salivate when they imagine a lemon and taking a bite of it. In fact, I was doing a group with a woman who had head and neck cancer, and she'd lost a lot of her saliva glands during treatment. So she would always have to have water on her desk to keep her mouth wet. And so she wound up using this lemon imagery to increase saliva production. So most people imagine that there is some saliva production or even puckering up in response to this, but is there really a lemon here? No, it's just your thoughts. It's your thoughts imagining that they're a lemon, and that your thoughts can actually have a physiological effect on your body. So this is kind of a simple exercise. I mean, who cares about a lemon except the woman who really used it? But imagine if you're imagining you're driving to work and you're thinking about everything you've got to do that day. Your body is acting as if you're at work and you're doing that stuff. Imagine that you're walking along in the woods, but you're thinking about an argument that you had with your spouse or one of your kids, or a problem that you're just trying to wrestle with. Your body's acting as if you're actually having that argument or in that stressful situation. So thoughts are really powerful. So this is good news, because like I said before, it's not the situation itself that affects us all these different ways, it's our automatic thoughts. The good news about that is that we can challenge them. Sometimes these thoughts aren't accurate. When I was a kid, my dad died in a train accident when I was 9. And so as I grew older and people would be late coming home, I would have this thought, oh, maybe they've died in an accident. And I would have that stressful feeling, oh my gosh. And then as I grew, I knew that I learned over time that people are late for all sorts of reasons. I have a friend who's late all the time. And if I'm waiting for her at lunch, I can either think, and she's late in 15 minutes, I can think, oh no, she's been in an accident. I'm going to feel one way. I could think, oh, great, I've got a little time to catch my breath and go through my email. That'll make me feel another way. So it's not the situation, it's how you think about it. And that's important. Sometimes our thoughts are accurate, sometimes they're not. If they're not accurate, we can work to change them to more helpful or accurate thoughts. We spend like 2 weeks talking about this in our SMART groups. If our thoughts are accurate, then we move into coping. When we talk about coping, say all situations have controllable aspects and uncontrollable aspects. Even something like, will my cancer come back? What do you have control over in that? You do have control over taking care of your diet, exercising, going for regular follow-up exams so that you catch it if it does come back. But you don't have control over if it comes back or where. So why do we care about that? Because we use problem-focused coping for the controllable aspects of the situation and emotion-focused coping for the uncontrollable aspects. So problem-focused coping is doing stuff. It's asking for help, getting more information, going in for your follow-up appointments. Emotion-focused coping is talking to a friend about how you're feeling, doing relaxation practice, massage. All those things help work with the natural and accurate feelings that we have in response to a situation. People tend to be better at one than the other. So there's some people that are doers. They just want to do problem-focused coping. And then there's some people that just want to talk about it. And if you find that you're coping, and it's not getting better, you need to ask yourself, am I doing both problem-focused and emotion-focused coping? I always put this one in at the holidays. Dark chocolate helps ease emotional stress. In moderation, I keep a little chocolate in my desk, and this is why. Enough about that. Exercise is a great way to cope with stress. When you think about the fight or flight response, that's what's driving all of these physiological changes in our body, the sympathetic nervous system and the parasympathetic nervous system. So exercise is great. You get to run and get all of those things, those stress hormones that our body's producing when we're stressed out. Because think about when our ancestors were stressed, they would have to run or fight in order to escape it or freeze, but we're stuck in traffic. So how can you get some of that? Our body wants to exercise. Our body wants to get this stuff out. So exercise is great. Yoga is good. It's movement and meditation. Social support. We spend a couple of weeks talking about social support. That's the support you get from your friends and family. And that's a really powerful buffer of the effects of stress. We talked earlier about how social isolation is hard on cancer survivors, well, ovarian cancer survivors in particular, but we are very social creatures, and social support can be a great buffer of the effects of stress. And then meditation, mindfulness meditation is becoming all the rage, and that is a really helpful way to cope with stress. And each week in our groups, we have a different type of either relaxation practice or a meditation practice. Here's another, I collect these sort of stress management cartoons. This one says, you can see it's the scream room. It says occupied, and the guy is saying, that's part of our in-house stress management program. Frankly, I think we can do better. Another really great way to cope with stress is a gratitude journal or making a win list. In our groups, we have people write every day something that they're grateful for or something that gives their life meaning. I also like to write wins. And if you do 5 of those a day, you can actually start to change the environment in your brain. There's a, well, let's just practice right now. Imagine just close your eyes and think stress, think of grinding it out, thinking of adversity, having to work hard, trouble. Just notice how your body feels. And now let those images go. And now I want you to think of the words ease. I want you to think of somebody that you love and that loves you so completely. If you have grandkids, think of your grandkids. Think of being out in the woods, things that give your life meaning. Think of something that you're proud of that you accomplished. And how does that feel inside? Turns out that our bodies are wired to perceive stressful events as more salient. We lock onto those. That's why the news, if it bleeds, it leads. We are dialed into stressful events. And you can imagine how that would be adaptive. Our ancestors, the people that were fearful of things, they survived. Whoa, what is that big tiger over there with the long teeth? I'm going to just stay back here. And that person lived and their genes survived. But the person was like, wow, cool, I love this. He went closer, he did not survive. So you can imagine how it would be adaptive to find stressful situations more salient. I think of them like Velcro. But we know also that if you pay attention to the things that you're grateful for, the things that give your life meaning, that you can actually build positive emotions in your body, and happiness. And that's, I think of that as almost like Teflon. We've really got to work at it. We've got to really hug them to us to make them stick. So writing every day, or even saying to yourself every day 5 things you're grateful for, or give your life meaning, or things that you're proud of, successes, that can really make a difference. And I challenge you to just try it. If you don't believe me, try it. Get a little journal, just a cheap one, and just write every day 5 things that you're grateful for, or something that gives your life meaning, or a win. 5 lines. And you'll see that you are happier. So mindfulness and stress, we do a lot of practice with mindfulness. Staying present in the present moment reduces stress. When you think about the demands resources thing, that makes sense. Like I said, if I think about everything I've got to do, like even the rest of today or the rest of the month, I can feel really stressed. But if I think, what am I doing right now? It's not as stressful. Being fully present when you're out in the woods, looking at the trees, being with your family and your kids, that can be really, that reduces stress. So living in the past or the future brings the past and future demands into the present, adding to your perception of stress in that moment. So if you're, like I said, if you're thinking about a work problem or an argument that you had with your spouse, that's your body's acting as if you're actually in that situation. Planning is good, but then when you plan, just execute your plan moment by moment. Everybody says, I'm a good multitasker, but actually it's not multitasking, it's sequentially tasking. It's less efficient than doing one thing at a time, because you've got to get your attention locked on something, and then you got to break that and then lock it on something else. And it's just best to just stay focused on one thing at a time. And when you're doing it, be really fully present with it. When you're washing the dishes, just don't be thinking, okay, when I'm done with the dishes, I've got to do the laundry, and then I've got to pick up the living room. Just think, wow, the water feels really good. It's nice and warm. So smell it, just feel it, be really fully present with it. Guided imagery can help. I really like Health Journeys. They've been doing it for a long time. And the person, Belarus Naparstek, her products have been used in research for a lot. I mean, she's been around since the 80s. So her successful surgery guided imagery has been shown to reduce length of stay, complications from surgery, blood loss, pain medication usage afterwards. She's got some really good ones for chemotherapy that you can listen to while you're getting chemotherapy, to help with fatigue. Her sleep one has been shown to improve not just quantity of sleep, so you sleep longer, but your depth of sleep improves and it reduces stress. And then just relaxation and wellness. And this is, again, it's just taking your mind to a place. If your mind is imagining that it's being relaxed and using these relaxing images, your body is following suit. Your body's acting as if. So a lot of these things that I've been talking about are part of this program that we call Health Smart. It's stress management and relaxation training for health. This is a program that we're doing for cancer survivors. We're doing it now all online. It's 11. So this is the next generation of the intervention that I was talking about earlier that changed the DNA and also improved survival. We've added an extra week to talk about spirituality and mortality and working specifically with fear of recurrence. So it's 11 2-hour sessions. They go really fast and everybody's always sad when they're done. Barb can attest to that. You get a workbook with all the information. There's 11 relaxation recordings that you get via your phone so that you can practice in between groups. And then you get video access to the group. As I said, we do it with Zoom, and it's so great to not have to explain that to folks anymore. What the participants have said is, I didn't know I needed this workshop, but I did. It's been a game changer for me. I don't feel alone anymore. One of the nicest things about this is just being in a group with people who get it without even having to explain things. And I had one participant say, I think every cancer patient should go through this course.
I agree.
So that's my little plug for our Health Smart intervention. I'm the director of the Orion Center for Integrative Medicine. This is who we are. Two psychologists, myself and Anna Charbonneau. We're clinical health psychologists. Mary is an acupuncture therapist, as is Jessica. Jennifer Cerulli is a licensed massage practitioner, and also she does craniosacral work and lymphedema work. Gretchen Grunden is a registered dietitian. She used to work at the SCCA, and now she's in practice here. She's doing telehealth. I know you guys have good nutritionists there, but if you're looking for somebody, Gretchen is great, and you can find all of these folks on our website. We do the SMART groups, like I said, psychotherapy, acupuncture, nutrition, and oncology massage. So does anybody have any questions, or should we just do a quick guided relaxation? I will leave it up to you.
Let's do a exercise.
Do we do exercise?
Yes, they're great. They're
All right, I'm just gonna do a quick one then. All right, so go ahead and get yourself in a comfortable position. Oops, we gotta go back up. Let me get rid of this. Sitting squarely on your chair, can rock back and forth a little bit. When you're ready, close your eyes and just bring your awareness to your breath. We've been talking about the breath a bit today. That's the most commonly used stress management technique. And just start by taking a deep breath. Congratulate yourself for taking time for viewing this YouTube video or being present at this workshop. And take another deep breath. And just feel that relaxation response. And now just scan your body from the top of your head to the tips of your toes and look for any areas where you might be holding tension or tightness in your body, especially tension. Pay attention to your neck and shoulders. And if you find an area where you're holding tension, just go ahead and breathe into that area and let the tension go with the exhale. Good. Now see, feel, or imagine a ball of light above your head. This light is healing, relaxing energy. Make it whatever color it needs to be. Now just let this ball of light sink in through the top of your head into that beautiful brain of yours, that brain that's probably swimming with thoughts about the effects of stress and relaxation techniques. And just imagine the light kind of filling your brain and surrounding every single neuron. And as the light fills your brain, notice how your thoughts slow down and become more clear, just like a lake on a calm day where you can see all the way to the bottom. You might even imagine you just drop a stone in that very clear lake and you can just see it float all the way to the bottom before it lands in the nice soft sand. Good. Now notice that the light has now expanded. It's expanded from your brain and moving out to your forehead, into your forehead and relaxing your eyebrows. Now see it moving into the muscles around your eyes. Your eyes soften and relax. Now let the light work its way into your cheeks and jaw. The muscles in your cheeks and jaw relax. Good. We hold so much tension there, we're not even aware of it. Good. Now your entire head is filled with this beautiful, healing, relaxing light. Now the light melts down your neck and into your shoulders, completely filling those areas. And your neck and shoulders relax. And just let them relax, even just a little bit more. This is such a stressful time. Just really let your shoulders relax. Let any tension go. Good. Now let the light work its way into your arms, forearms, and hands, all the way to the tips of your fingers. So now both your arms and hands are completely filled with light. Let your arms and hands relax. Just let them relax even more. Just let them get really heavy. Good. Now let the light work its way into your chest and upper back. Take a beautiful breath in, breathing the light into your lungs. See the light filling your lungs, and it might even take on a different quality or sparkliness in your lungs. Just see it filling your lungs. And then with the next breath coming in, breathing light into your lungs, see the light that's in your lungs moving into your heart. And your heart is full of this beautiful, healing, relaxing energy. And just see that light being pumped throughout your body via the circulatory system. And know that for the rest of the day, every breath in, every beautiful breath in, you're breathing in this beautiful light energy. It's going from your lungs to your heart, from your heart to the rest of your body. Beautiful breath into your lungs and throughout your body for the rest of the day into the evening, bringing this beautiful energy with it. Now the light continues working its way into your abdomen and lower back, so now your entire torso is filled with light. And the muscles in your abdomen and back relax. And just see in your torso if the light needs to change color. Sometimes we're holding things in our torso, especially if we've had surgery there, that make it hard for the light to get in there, or it needs to be a slightly different color. Just go ahead and make it a different color if it needs to be in different parts of your torso. Good. Now let the light work its way into your legs, calves, and feet, all the way to the tips of your toes. So now both your legs are completely filled with this beautiful, healing, relaxing energy. The muscles in your legs and feet relax. Just let them relax even just a little bit more. Just don't let them get really heavy. Good. Now the light that completely fills your body, take a deep, deep breath in, and as you do, that light gets even brighter. So bright now that it's glowing on the surface of your skin. Just imagine that you step outside your body and look to see, are there any areas that need a little more light? And if you see an area that needs a little more light, just use your breath to bring light into that area. Good. Now take another beautiful breath in, and as you do, the light expands and it forms this beautiful cocoon of light all around you. Just notice what it feels like to be in this beautiful cocoon of light, feeling very safe, very relaxed, very much at peace. Just notice how your body feels in this nice relaxed state. Now, one more time, I want to give you that stress thermometer that we talked about earlier. Just imagine that I've given that to you and just see, what is it reading now? 0 is no stress at all. 10 is as stressed as it can be. What number is that at? Is it lower than it was before? It's great. Do you think it could get a little lower? I want you to just, if it could go a little bit lower, I want you to just imagine looking at it and seeing that like red stuff that's in a thermometer. Put your finger on the number where that red stuff reads, and then just see if you can pull that red stuff down 1 number, 1 degree. See if you can pull it down and see if your stress level falls accordingly. You may need to take a deep breath, breathing in, and then as you exhale, pull your finger down, like from 5 to 4, or from 4 to 3. How low can you get your stress thermometer to read by doing that? Just play around with that for a minute. Good. Excellent. Now I'm going to count from 3 to 1. And as I do, you're going to gradually bring your awareness back to the room, feeling refreshed and alert and relaxed and ready to do whatever else you need to do today with ease. 3, becoming more aware of your legs and feet, maybe wiggling your toes a little bit. 2, becoming more aware of your hands and arms, maybe wiggling your fingers a little bit. And 1, becoming more aware of your head and neck. Whenever you're ready, open your eyes and bring your awareness back to the room. Well done.
Thank you.
It is now 11 o'clock, but I guess we could take time for 1 or 2 questions if anybody's got them.
I just thank you. This is all so great. There's always so many takeaways. Thank you so much.
You're very welcome. You're very welcome. Is there anything else you want to add about the SMART program, Barb?
You know, if anybody knows someone who would benefit from that program, please, please, please get them involved, because it is so beneficial, so eye-opening, so it's just great. It's fabulous. I appreciate Bonnie so much. It's grown over the time that I've gotten to know her, and it's just incredible information. It's just stuff that I am way into. And it's just, I mean, she shows the science behind it. I mean, it's not just a thought process. It's science. It's a fact. So I love it. Really love it. Encourage anyone that can possibly get into it, get into it.
Thank you, Barb.
Absolutely.
Thank you, everybody, for your kind attention. I really appreciate you making this time for yourself to learn something new, to bring a little bit of light into your life and go carry it out to others. Any other comments, Katie, before we go?
Oh, Bonnie, thank you so much for doing this today. And as I said, this will be converted to a YouTube video that we will post and make available to everybody. So people who can't attend in real time can watch on their own time. Plus, if someone wants to re-listen to this, they can do that as well. I
Good.
just thank you so much for your time.